you like that. Taking care of yourself is a love no one else could ever give. Exercise and eating healthy, that's the best thing for your body. Smoking and drinking will not help. Sniffing and drugs, you'll hurt yourself. You gotta remember to check your blood pressure. You gotta take good care of yourself.
Good evening, my viewing audience, and Happy New Year. In with the first edition of Health Matters for 2021, I am your host, Chevany Nisbet, Senior Health Educator at the Health Promotion Unit. This week's edition, we will be talking about cervical cancer. Cervical Cancer Awareness Month is in the month of January every year, and this year it's been acknowledged under the theme, Get Informed, Get Screened, Get Vaccinated. We will be having a 3-part show for Cervical Cancer Awareness Month, and this first one will be about what is cervical cancer. Cervical cancer is a type of cancer that occurs in the cells of the cervix, the lower part of the uterus that connects to the vagina. Various strains of the human papillomavirus HPV, a sexually transmitted infection, play a role in causing most cervical cancer. When exposed to HPV, the body's immune system typically prevents the virus from doing harm. In a small percentage of people, however, the virus survives for years, contributing to the process that causes some cervical cells to become cancer cells. You can reduce your risk of developing cervical cancer by having screening tests done and receiving a vaccine that protects against HPV prevention. Symptoms. Early stage cervical cancer generally produces no signs or symptoms. Signs and symptoms of more advanced cervical cancer include vaginal bleeding after intercourse, between periods or after menopause. Watery, bloody vaginal discharge that may be heavy and have a foul odor. Pelvic pain or pain during intercourse. When to see a doctor. Make an appointment with your doctor if you have any signs or symptoms that concern you. Causes. Cervical cancer begins when healthy cells in the cervix develop changes or mutations in their DNA. A cell's DNA contains the instructions that tell a cell what to do. Healthy cells grow and multiply at a set rate, eventually dying at a set time. The mutations tell the cells to grow and multiply out of control, and they don't die. The accumulating abnormal cells form a mass, or a tumor. Cancer cells invade nearby tissues and can break off from a tumor to spread or metastasize elsewhere in the body. It isn't clear what causes cervical cancer, but it's certain that HPV or human papillomavirus plays a role. HPV is very common, and most people with the virus never develop cancer. This means other factors, such as your environment or your lifestyle choices, also determine whether you will develop cervical cancer. Types of cervical cancer. The type of cervical cancer that you have helps determine your prognosis and treatment. The main types of cervical cancer are squamous cell carcinoma. This type of cervical cancer begins in the thin, flat cells or the squamous cells lining the outer part of the cervix, which projects into the vagina. Most cervical cancers are squamous cell carcinomas. Adenocarcinoma. This type of cervical cancer begins in the column-shaped granular cells that line the cervical canal. Sometimes, both types of cells are involved in cervical cancer. Very rarely, cancer occurs in other cells in the cervix. Risk factors. Risk factors for cervical cancer include many sexual partners. The greater your number of sexual partners and the greater your partner's number of sexual partners, the greater your chance of acquiring HPV. Early sexual activity. Having sex at an early age increases your risk of HPV. Other sexually transmitted infections or STIs. Having other STIs such as chlamydia, gonorrhea, syphilis, and HIV and AIDS increases your risk of HPV. A weakened immune system. You may be more likely to develop cervical cancer if your immune system is weakened by another health condition and you have HPV. Smoking. Smoking is associated with squamous cell cervical cancer. Exposure to miscarriage prevention drug. If your mother took a drug called diethylstilbestrol or DES while pregnant in the 1950s, you may have an increased risk of certain type of cervical cancer called clear cell adenocarcinoma. Prevention. To reduce your risk of cervical cancer, ask your doctor about the HPV vaccine. Receiving a vaccination to prevent HPV infection may reduce your risk of cervical cancer and other HPV-related cancers. Ask your doctor whether an HPV vaccine is appropriate for you. Have routine Pap tests. Pap tests or Pap smear tests can detect precancerous conditions of the cervix, so they can be monitored or treated in order to prevent cervical cancer. Most medical organizations suggest beginning routine Pap tests at age 21 and repeating them every few years. Practice safe sex. Reduce your risk of cervical cancer by taking measures to prevent sexually transmitted infections, such as using a condom every time you have sex and limiting the number of sexual partners you have. Don't smoke. If you don't smoke, don't start. If you do smoke, talk to your doctor about strategies to help you quit. Stay tuned for more information on cervical cancer. In light of Cervical Cancer Awareness Month, the Ministry of Health Community Nursing Services will be hosting their annual Pap smear drive on Saturday, January 30th from 8 a.m. to 11 a.m. at all health centers on island. We are taking this opportunity to encourage all women who have ever had sex to get their Pap smears done. It is free of cost. Individuals who will be getting their Pap smear are asked to adhere to the following rules. Avoid having sexual intercourse for at least 72 hours before your Pap smear date. Avoid douching or using any vaginal medicines or spermicidal foams, creams, or jellies for 24 hours before having a Pap smear. Try not to schedule a Pap smear during your menstrual period. Schedule 1 week after completion of your menstrual period. Take advantage of getting your free Pap smears. Get informed, get screened, get vaccinated. Be sure to log on to our Facebook page Nevis HPU and our Instagram page hpu.nevis to test your knowledge on cervical cancer by taking part in our quizzes, as well as to get updates on our various activities. And that was our edition of Health Matters on what is cervical cancer. Stay tuned next week when we tell you about the preventative methods of cervical cancer, specifically the HPV vaccine. This week's edition of Health Matters was hosted by yours truly, Shavani Nisbet, Senior Health Educator at the Health Promotion Unit. The fruit of the week is banana. Banana is a rich source of potassium and fiber. Have yourself some bananas this week. See you soon.
Who's gonna love you like that? Taking care of yourself is a love no one else could ever give. Exercise and eating healthy, that's the best thing for your body. Smoking and drinking will not help. Sniffing and drugs, you'll hurt yourself. You gotta remember to check your blood pressure. You gotta take good care of yourself.